Welcome to Healthcare Triage Live, and if you've been with us literally 5 seconds ago, you would have seen pieces of stuff crashing down. Anyway, we're here, we're live. So, before I get to anything else, look, I have a Healthcare Triage poster in my office, and I have the Healthcare Triage mug, and I love our merch, but the new stuff is so awesome, we're gonna talk about it for a second. Lunchbox. Look at the Healthcare Triage lunchbox. I'm so excited for this. I'm literally giving this one to my daughter for Hanukkah. She doesn't know, and she's in school and isn't going to see Healthcare Triage Live. So she doesn't know, but she's going to be so excited by this. You can get this at hctmerch.com. It's so awesome. Plus, I have to wear like my badges at work to get in and out of all the different buildings, and I have one of these, these things. But look, now there's a Healthcare Triage one. It's like Healthcare Triage is making the stuff I need. This is also available at hctmerch.com. I'm going to go home. I'm going to put this on. I'll be wearing this as of tomorrow at work. So that stuff, the old stuff, it's all this great merch. The holidays are coming. You need stuff to buy. Healthcare Triage merch. While you're there, you could also consider, of course, checking out a Facebook page, facebook.com/healthcaretriage. And I always have to talk about Patreon. It's a great way to support the show, patreon.com/healthcaretriage. We're always humbled and overwhelmed by your support. It helps us to make Healthcare Triage bigger and better. Does cost money to make all this stuff. Stan and Mark are incredibly valuable. We need to pay salaries. We need to help people. We need to do this. So anyway, any help you can give us is appreciated. Of course, Healthcare Triage is all going to be free, so it doesn't matter. But if you have it, it's the holiday season. If you're thinking away, oh my God, I just have too much money. Where do I put it? Patreon.com/healthcaretriage. Anyway, let's get started. Hi, Dr. Aaron. Do studies show if there are any health benefits by having indoor plants to improve air quality, not including psychological benefits? I doubt it. Because mostly, come on, air quality is determined by much more than, whether or not you have a household plant. Things like pollution or particles or things like that are going to be determined by things in the environment. Air filtration and your air conditioning and everything else is going to be important. Plants are decent for in general in the world, regulating sort of the amount of carbon dioxide and oxygen and whatnot, but a plant in your house just isn't going to make that much of a difference. Having said that, I'm not 100% sure that there are no good studies, but if there were really good studies showing that having plants markedly improved air quality to the point where it could actually change health, we'd all be touting it and talking about it, and we don't. So I'm going to bet that there isn't. Now, of course, you note that there could be psychological benefits. That may be true. And this is one, again, where always weigh the risks and the benefits. The harms of having a plant in your house are like infinitesimal. I can't even almost think of one. So, why not? If it makes you happy, go ahead. David Devine asks, what studies have been done on frequency and timing of toothbrushing? Say brushing immediately after eating versus 1 hour later, or brushing once a day versus after every meal. So, the evidence is not nearly as good as you'd hope. However, there is evidence that brushing with a fluoride toothpaste does reduce the risk, I believe, of gum disease and probably cavities as well. I don't think it gets down to rigorously like how long after a meal or the timing. The general thinking, of course, is that the less time food has to set up shop in your mouth, the less time it has for bacteria to develop. But that does take time. It's unlikely to happen like immediately after you eat. Because again, the food's not necessarily the problem as much as the bacteria and everything else that you're worried about. I brush my teeth twice a day. When I wake up in the morning and before I go to bed with fluoride toothpaste. I think that's what most of the studies look at. Other people I know brush after every meal, or they're obsessed about brushing. So much of this still is genetics. I have almost no cavities in my mouth. I have one filling. And I got that when I had braces as an adult, and I blame it on the braces, not on my teeth brushing. My wife, on the other hand, is obsessed with her dental hygiene, and I don't think she has a tooth in her mouth that doesn't have a filling. So clearly there's much more at work here, as we talked about in our episode on the evidence behind a lot of dental practices than this. So here's the thing, do what works for you. Don't let other people lecture you. I think brushing twice a day with fluoride toothpaste is where the evidence is. That is enough. You should just do that. And if anyone tells you differently, they're just sort of making it up. Thomas Rigney, I've been seeing a lot of stories about the use of psychedelics for depression. Hopefully you've seen when we've covered them in Healthcare Triage. Psilocybin, ketamine, and mdma. What do you know of any research being done on this? I know we've done Healthcare Triage News on this more than once. I think with mushrooms. I think maybe with, not so much on ecstasy. We've done we've done on, what was the smoking one?
It was smoking mushrooms.
Yeah, I think it was shrooms and something else, and it's like, and it worked. It worked. Of course, these are very small studies, but they're still decently well done studies, and it should lead us to further research, which was the conclusion we had in those episodes. Having said that, this is not a call to go out and rush to do all these drugs to relieve your depression. You need to. These were all done under tightly regulated conditions with the help of medical professionals. That is where the current level of research is, and I think it's worth following up in the future. Go watch those episodes. Adam LP, I frequently wake up in the morning and grab a 0-calorie, 0-sugar energy drink. I know you've done episodes on artificial sweeteners in coffee. Is this an unhealthy habit? Coffee tears me up. Does it work for you? Okay. As long as you know what you're doing. Overdoing it with those energy drinks can be a problem, I think, because some people have had bad reactions. But, if you drink a 0-calorie, no sugar, energy drink in the morning, one a day, and it's not hurting you, and you feel, so be it. Fine. As always, I'd say, know what you're putting in your body. It's if it's got tons of chemicals and stuff in it, and it's unregulated and everything else, be a concern, but whatever. My wife doesn't drink coffee, and she'll probably be upset. No, once in a while I've seen her have a Diet Coke earlier than I would have a Diet Coke. Not because I'm judging the timing, it just seems too early in the morning for Diet Coke for me. But health-wise, who gives a crap? The body doesn't know what time of the day it is. It doesn't care whether you're drinking the Diet Coke at 9 a.m. or 9 p.m. It's just stuff, it's nutrients, and one Diet Coke ain't gonna hurt you. So if that's what she does, this is what you do. I like coffee, c'est la vie. Cuddy, my mom wants me to see a doctor who does integrative medicine, but I haven't found one who isn't endorsing stuff like aromatherapy or even crystals. What's your take on this type of practice? I'm struggling so hard not to roll my eyes epically right now. Okay, so the theory behind integrative medicine, the idea that we're going to take the best of all worlds, I'm all fine with that. My problem is not the idea that we use, we've done a healthcare triage episode on this too, which I encourage you to watch. It's not the dichotomy between Eastern and Western medicine or complementary or traditional medicine. For me, it's proven and unproven. And I have no problem with people that want to use proven things from all cultures. Acupuncture has been shown in some randomized controlled trials to work for pain. If that works for you, great. But on the other hand, tons of stuff, aromatherapy, no. Maybe good smells make you happy, but curing disease hasn't been shown to work. Crystals, no evidence. So my theory is that not about integrative medicine, it's about the use of unproven things and fostering them off as being proven and working. So if you have something serious and you're trying to treat it with stuff that isn't proven to work, I got a problem with that. You're welcome to do it, but I wouldn't recommend it. If it is proven to work, I don't care where it comes from. The issue with some of these practices in integrative medicine is that they don't seem to have a very high bar for what is proven to work. Some. So that's my issue. So it's no problem going to see them, but I would want to know the evidence, the harms, the risks, and the benefits for all these things. And don't forget the financial harm. If they're charging you a lot of money for crystals, that's a harm. If they're telling you smell nice things and it's free, I don't give a crap. But if if you're paying hard-earned money for stuff that doesn't work, that's an issue. David Devine again. If you could perform a longitudinal cohort study in the American population, what questions would you focus on? So many! Oh my God, this is the thing, oh my God, behavior, nutrition, parenting, what makes a good kid, what makes success, what leads to problems later in life. We just don't know the answers to so many of these questions. Years ago, there was a study proposed called the National Children's Study where they were going to literally start following 100,000 kids at birth for basically their childhood. It was going to cost billions of dollars. And they started it and they ramped it up and then they said, oh my God, this costs so much money, we're not doing it. And they just sort of basically bailed on it. Unfortunately, doing those kinds of studies, like I just said, costs ridiculous amounts of money sometimes, unless you have natural ways to follow. This is the reason that we see so many publications out of the Women's Health Study or the Health Professional Survey. A lot of these cohorts that were set up because the major work's been done. Now we're just trying to analyze the same data over and over and over again because they're expensive. Following these people over time is expensive, but God, I'm a pediatrician. I have so many questions about what leads to successful children, what actually affects them in nutrition, how do they actually grow, how do they develop, what's the biggest, we just don't know the answers to those as much as we'd like. Next person has two related questions. One, Your job sounds awesome. How did you get where you are? I'm considering medical school, but I have misophonia, which is select sound sensitivity syndrome triggered by sniffing. This sometimes leads to anxiety attacks. Cognitive behavioral therapy hasn't helped much, and the SSRIs that they take make them feel sick. This person's interested in fields like pathology and OB-GYN, where I wouldn't be exposed to these sounds as much. He's worried about it, or she is worried about her inability to get through medical school. Will this have a large enough impact on their ability to care for patients or obtain a medical license that they should avoid a career in medicine? I'm saying 2 questions. One's about my job. I'll tackle that second. The first is about what do you do with your misophonia? Okay, that's not, we were just talking about this earlier, and Stan and I have talked about it before. I am triggered by certain sounds that I hear, where it's like, sometimes when one of my kids goes, it's like it's this mouth sound I hear when he's like, and it literally drives me, like I'm like enraged, and I'm like, oh God, and I don't want to tell him, because like, it's not his fault, but somehow it sets me off. Yours sounds worse. So clearly you're doing the right things. You're trying therapy, you're trying the drugs, you're trying whatever it is, and I encourage you to do that. And you're worried about this is gonna affect your ability to practice medicine. Well, the truth of the matter is like how much it affects you. I have ulcerative colitis, and I've had rude doctors in my training ask me if that meant I couldn't be a doctor. You know what? Screw them. Yes, I can be a doctor. I know doctors who have mental health issues. I know doctors who have diabetes. I know doctors who have other illnesses. I know doctors who've had cancer. I know doctors who have disability. Who cares? If you can function and do the job you're supposed to do, that's what matters. So part of this is going to be a judgment call. Like, how much does this affect you? Will you be able to do? But I'd imagine if you can't be a doctor, there are other jobs you can't do as well. So don't let someone just talk you out of this. You have to sometimes get treatment and figure it out. Okay, the other question, my job sounds awesome. How did I get where I am? Okay. It's a great question, and I often, I get asked this once in a while. First of all, I do think my job is awesome. But my job is cobbled together from lots of stuff. So my real job at work is I'm a health services researcher, and I do research, and I'm an independent investigator, and I get funded, and I work in a medical school. So that was medical school residency, a research fellowship, an academic job, assistant professor, associate professor. Now I'm an associate dean as well, and I do some teaching. I train lots of I train lots of faculty, and I mentor them in becoming researchers. I do my own research. I apply for grants, NIH funding, all that stuff. And that is my job. Then there's all the stuff that I get to do because like this came about, I think, because of writing. I got really into sort of writing and blogging. That led to writing in other places. That's how I got connected to healthcare triage. That's how I got to do this. That's how I get to do the Upshot in the New York Times. It's just getting skilled, continuing to work, really working at those things. I blogged for years before I was paid to write. And I did, I do this. This is not my job, but this is awesome. This pays me in joy. And so, I don't know. I feel like I'm going around in circles, but I think it's just, get skilled at something, get good at it, and then continue to practice and keep trying. And then I think, the more you do, the more you do. And so as long as you keep working at it, you do better. In this job, it was like medicine, and then research training, and then talking about it, and writing about policy and research, and reading a lot, and writing a lot, and each of those things work. Find someone who has the job you have and get them to mentor you. Has the job you want and get them to mentor you. I tell people that all the time. Find the person who has the job you want and talk to them a lot. How did they get there? How do they continue to become better at what they do? End kicker. I've heard next year Congress could fund Medicaid with block grants or per-capita allotments. Could you discuss the pros and cons of those? How do they work? Oh my God, I'm going to need to do episodes on this because, yes, in fact, I'm going to write an Upshot column on this probably eventually. We'll do episodes, but the gist of it is that right now Medicaid is what we call a defined benefit program. Everybody gets what they need, and then the federal government and the states pay for it in a ratio. Block grants instead would give the states a set amount of money and say, make it work with this amount of money. Now that can be done totally or on a per person basis. Like you're covering this many people, you get this much money. It would put more of the burden on the states to decide how to spend the money, who to cover, how much to reimburse, figure out ways to make this all work. Having said that, the kicker, the real sticking point is how those block grants change over time. If they're well funded, this is perfectly reasonable. It makes sense that the local states might have a better decision or a better sense of how they want to spend their money. That's fine. If we fund it adequately, that's great. The problem is that lots of the block grant programs really start to restrict the amount of the block grant over time, and that leaves states in the lurch that, over time they'll have less and less and less money. Well, how are they going to make it work? There's no magic here. And so that's the sticker. The pros and cons. The pros are there's more theoretical chance for innovation at a local level. States could make more state-based decisions about how much to cover, who to cover more, cover less. It's a local decision. The cons are there might not be enough money there, especially if the federal government uses this as an opportunity to reduce the amount of money they plan to spend on Medicaid. We'll see. Jessica Hodge 3, what care do you provide to kids as a pediatrician, doc? Doc for depression and other mental health problems, any preventive care, healthcare. Well, look, I'm a pediatrician, so as I said, I'm mostly research and teaching. I do a half day of clinic every other week. I work at the Children's Hospital associated with us. I see kids, some are well care, some are urgent care visits. I'd probably say I err more on the urgent care side because I don't practice enough to sort of have a general load of kids that say I'm their doctor. Because that's really not fair to them. I'm not in the office enough. So I will do well visits when people can't get into the regular doctor, and I do sick visits for the same kind of thing. But I see kids who have mental health issues and depression all the time. It's a part of life. And so, I do those kinds of referrals as well. So I do lots of preventive care. That's what pediatricians do. Patrick Foster asks, do you find the health info feedback from my Apple Watch useful? Do you like it? I find the nudges to stand up are sometimes helpful, although I do a pretty good job of it anyway. And I do like the fact that it keeps track of my walking, because that's my sort of, I like the idea that it's tracking 30 minutes of my being physically active a day. That's it, 100%. I don't count the steps. I don't care what it says. I just like to know that I'm 30 minutes of activity and that I'm standing up once in a while, because that's what we've talked about in previous episodes, and that's what we know sort of matters for health. Other than that, I do love my Apple Watch, but more because I like the fact that I can get texts and messages on it. I like the fact that I can sort of tell Siri to set alerts and reminders on my watch. I like that it's easier for me to see stuff than to get out my watch. To get out my phone and check the same things, and that's almost the extent of it. But I do like it. I do like it. It's not that expensive as sort of nice watches go. That's the thing. Dan Luzu, do face masks help contain the spread of contagious diseases? I'd really appreciate an answer. It depends on the disease. If it's an amazingly communicable thing and you've got it, you're probably helping other people if you wear it. But when you see people on planes that put them on just as a preventive thing, that's not helping almost at all. The danger is not the air on a plane. Air circulates incredibly well on a plane. In fact, they probably circulate and filter the air far more than in your office building or your house, certainly. The danger, of course, in the plane is everything you touch. Because if people, touch the tray, unless they were wiping down that tray between each flight, and I doubt they are, that's where the dirt is. The dirt's in the seat, the dirt's on the buttons that you touch that nobody probably ever cleans. I don't know. So, when you see people just sort of walking around with those masks, they're not probably getting much, unless it's, of course, preventing them from touching their mouth. But they got to take it off to eat. Hand washing is what really matters, because that's where you're going to get it hand to mouth and all of those things. Not as many diseases are caught from the air as you might think. More of them are caught by touching hand. That's why hand washing is so important. Some diseases by the air, not as many as you think. Let's see, acrophobic pixie, what's my opinion on acupuncture and its efficacy for pain management? We talk about this all the time. There's been some randomized controlled trials which show that it works better even than sham placebo. Now granted, it's not a huge adjustment, but the fact that there's a difference is a good deal. So this is where it gets to the point where it's you could try it, see if it works for you. Again, always weigh the harms and the benefits. If everything else, the needles are clean and it's hygienic, the harms on the low side, the cost is the major issue. And if the cost is not a barrier to you, it at least has some evidence behind it. There you go. Now, when you start talking about other stuff, the evidence is not really there on acupuncture. But for pain management, there's some pretty decent studies. Emma Moeller asks, What's my best tip as for a medical student who wants to be an awesome doctor who patients like, who make the best decision for every patient? Those are almost two separate things. So again, I'm a pediatrician. How do I get patients to like me? I know what they like. Like, I'm incredibly well versed in what kids are doing. I play video games, I know the shows, I know comic book stuff. And so like, the other thing too is I make sure that every time I enter the office, I sit down and I talk to the child for 5 minutes before I ask the parent a single question. I ask them about school. I ask them what they want to be when they go. I had this awesome conversation with a little girl. I asked her what she wanted to be when she grew up, and she said superhero. And I just couldn't help myself. I'm like, how are you going to get the powers? You know, and she had this whole thing, and I was like, if you pull that off, you got to come back and talk to me and tell me how you got the powers, because I'd like Wonder Woman's powers. And if you engage with them, they are far more likely to talk to you. And then when I talk to parents, I make sure that, like, you know, you ask them what matters. And you try to be personable. Some of it is just a social game. You just have to treat people like people and that you're interested in them. That's how you get patients to like you. Now, sometimes patients have needs which I can't fulfill, and then they don't like me. Like, if they're coming for an antibiotic and I'm not going to give it, I know that deep down inside they're not going to like me, and I'm okay with that. Everyone can't like me all of the time. It's not possible. It's not a good goal. You can't make everyone anywhere. Like, the President of the United States is probably hated by half the country, and he's the most powerful person in the world, or she someday. Regardless, you know, that's not your goal, but certainly you want the most. Now, use the best information for your patients. You got to keep up on the literature. You got to constantly ask questions of your colleagues. You got to constantly ask questions of yourselves. You got to know what's going on. I say watch healthcare triage. Read stuff that tries to explain stuff to you correctly. Know about what's the truth is and the evidence behind it, and then, you know, be honest with your patients so that they can make decisions based upon the best evidence that's available. We're running out of time, so I'm going to do these last few. Tivopox. How should one go about finding a primary doctor in a new city and a doctor with open patient slots? Two separate questions. Find people you trust and ask them who is a good doctor. If those people are in the medical field, that's even better. I get lots of requests from friends all the time about who they should see as doctors. I'm usually pretty consistent, and it's usually people I'm friends with, because I'm like, that's a good guy, I know he's smart, he's really nice. That's what you want, just we were talking about. So it's mostly, I'd say, by word of mouth. That's the best way that I know how to do it. Find someone in the medical field you trust and ask them. What was the second thing? Doctor with open patient slots? Well, there's no way to know other than call in the office. Call the office and ask. See if you can get that medical person you talk to get you an in. Augusto Griffi, are you going to continue with your worldwide healthcare system series? If so, can you do Italy next? We should go back to this. The problem is that, no, there's not a problem so much as that, like, I feel like we've covered most of the different types of systems. So it gets a little repetitive. Like, they get different in tiny nuances, but not the major differences. It's like, there's a total single payer system. There's an total government run system. There's a very consumer driven system. This is a private one system. This one offers nonprofits. So I felt like we'd cover most of them, but we could get back to that. I will think hard about it. Robert Anthony Luna, do you believe that expanded use of mid-level practitioners from physician assistants, MPs are effective in modern medicine? My wife's a nurse practitioner, so I'm biased. I think she's awesome. I think that nurse practitioners and PAs are great in certain roles. And I think the evidence in general shows that they are, just as good in often providing what they're providing and the things we can measure as doctors. So in certain roles, yes. We will discuss this in an upcoming episode on Access, actually. Where was that? Did that just go up?
Yeah, Access was fun.
Yeah, I think I even mentioned it, that the evidence on nurse practitioners and mid-level practitioners is just as good. So there you go. Final question. Adam Schmidt, I'm a teacher, and there's been lots of talk about neuroplasticity and how student brains work. Is just throwing neurology vocabulary on top of social science research with the real science? I tend to lean more towards the former. We tend to use these fancy words to talk about all this stuff, but they do studies where, like, again, it's like these aren't the cohort studies or the clinical trials we'd like. They're just associations at time points, and they talk about brain chemicals and PET scans. And a lot of times I'm like, yeah, we knew that. Like, I love the studies where they show that, if you do MRIs or like PET scans of people that smoke pot, you can see changes in the brain. Of course you can see changes in the brain. That's a feature, not a bug. People wouldn't be using pot if it didn't actually cause changes in their brain. The question is, are those changes caused by the pot or associated with the pot? We don't really know. And are those changes long-term and detrimental? That we're not really as sure of. But of course you see different brains with different people. Yes, we just don't know enough to take that next step and be like, what does that mean? How does that cause stuff? What do you do with it? And a lot of these neuro studies, neuroplasticity and stuff like that, are at that real basic science level without the translational aspects that we need. And that's it, we're out of time. Consider supporting us on patreon.com/healthcaretrash. Subscribe to the channel. I never say that, but we're at 198,000 subscribers, and I'd love to see us break 200,000. I don't really get anything for that, but I'd really like to see it. You know you want this lunchbox. HCTmerch.com. Go buy it. And then this little thing. I mean, I know it's a little thing to hold your badges, but my God, I need this at work. You may too. Go buy one of those. Facebook.com/healthcaretriage. Continue to watch the show. We got a couple news episodes left this season, a couple episodes left, and then 2016 is over. And then we will have 2017. And it's going to be a really interesting year with respect to health policy and whatnot. We're going to have lots to talk about. This will be our last live show of the year. I'm going on vacation next week. I will be driving on my way to Universal Studios and then to a place with condo we rented in Florida, and I'm going to relax and try not to do so much on the internet or do any work. And I want to spend time with my kids and my wife and some friends, and it's going to be awesome, and I will miss all of you, and we will not be here. So thank you for watching. This is the last time I can say it live. Thank you for watching Healthcare Triage. Try to support us in merch, which you'll love anyway. Try to support us at Patreon. We will see you in 2017.